Okay, so to talk, you have to press 7 to mute the line. Press star 6 to mute the line so the line can be clear so we can all hear the information that's being shared. The chat box is also available to you all to use for questions and information that you needed throughout the webinar. I will be sending an evaluation survey at the end of the webinar, along with the tool itself, a PDF tool that will come with the slide set that I will be using throughout the webinar. So please make sure that you fill the survey out at the end of the webinar. I'll send it in right about an hour after we end the webinar, so you have access to the tool and the survey itself. So let's get started, and I am going to share my screen so I can use the slide on my screen on my computer. Okay, there we go. And welcome to CBA Connect. Like I say, it's a beautiful day today here from New York. I hope you are having a great day. And let's get started with our material today. So this is a quick tools and sharing, tips and sharing, CBA Connect, to get connected with all of you. Some of you might know me already, but you get a chance, if you don't know me, you get a chance to learn a little bit about me very, very shortly. Alright, so just a little background about who we are at the Latino Commission on AIDS. We're a nonprofit organization that's been working in the HIV field since the 90s, and we work all over the United States providing services that range from behavioral research, health promotion, capacity building assistance, which is CBA, and testing and access to care is here in New York. We do HIV testing and Hep C testing, and policy and community mobilization, which is more in the South in our North Carolina office. So a little bit about capacity building assistance program. We are funded by the CDC to provide services that are listed under the 3 categories here you see on the slide, and to also provide training and technical assistance along with the IBs, such as CLEAR, SNS, which is the public health strategies, just to help you or provide assistance to many of you on the field doing the groundwork. And CBA is also available to you free of charge in case you needed this assistance. Alright, so this is me. This is Hope Zewu, just to put the face to the name. I know you've seen my name before, but those of you who have never seen me before, this is what I look like. Alright, so let's get started with our Social Network Strategy Quality Assurance Evaluation Tool today. Alright, so the objective is to provide an overview of what SNS is, which is Social Network Strategy, discuss key steps for the implementation of SNS, and also present the evaluation tool that we developed here in-house, and really present a missed opportunity that might come anywhere in between the implementation of SNS. Alright, so SNS, social network strategies, right? It's based on the underlying principle that people in the same social network have similar risk or risk behavior that they engage in or that they share. So in addition to the social network, there's a trust that has been built within, and that also serve as an influence that that anyone that belongs to a specific social network share with each other. So the strategy has been identifying and connecting with high-risk participants and asking them to really engage with their social network and enlist them and really enlisting the members of those social networks to access services that are not really available to them, or they don't have access to, or will unlikely go to themselves, right? So when we think about social network strategies, it's really tapping into it's a strategy that help us tap into our network, right? Who we are interacting with, our group of friends, who we come into contact on daily basis or occasionally that we have that influences over, right? So when it comes to social network, you want to identify that index recruiter, right? The person that is going to be the main person who is going to be contacting their network members and bringing those network in for testing, right? Because we all know social network strategies is used for CTR testing as a recruitment strategies, or it can also be used as a recruitment strategy for other services, but it is mainly used for CTR services, which is counseling, testing, and referrals. So we have our index recruiters who is connecting with their social network, their members, their network associates, their member within that specific network, right? So here on the slide, we see that our index recruiter or our first recruiter is HIV positive, right? The box is red, meaning that it's HIV positive. And we see all the people that this specific recruiter brought in from the specific network. The whites identifying that they came into the agency, the CTR office agency, and they got tested and the result is negative. So the red circle, or the people that came in that the network, the recruiter referred to the agency, they came in, they got tested, however, they test positive, right? So you identify positive people who are living with HIV, however, are not aware of their status, right? So they came in, got tested, and they're now aware of their status, they're positive, and you connect them to the services that are appropriate for them. And you see that from all the network associates that the recruiter brought in, so all the white circle, those are the network associates, including the red as well. So all the circle around the index recruiter, one of those network associates became a recruiter. And that particular network associate became a recruiter and referred all the people from that specific network that might have been identified as a high risk as well. However, this specific recruiter did not bring in any positive. If you see, there's another recruiter, another network associate who was identified positive for the initial from, sorry, let's get back to our slide. Oops. Here. Sorry about that. Oops. We're not there yet. So I was going to show you here. We have a network associate who was identified positive, who became a recruiter and was able to refer other network associates as well. And one of them was identified positive as well. And you see the web just kept growing and growing and growing. And this is the idea of social network strategies. As you can see here, one of them is yellow, meaning the network associate came in, for some reason they didn't get tested, and we do not know the status of this particular person. But this is overall, in a nutshell, what social network strategy is. But let's really unpack what the tool is really going to help us enhance the implementation of social network strategies. Right, so the goal of the tool is really providing a guidance in terms of the element and the steps that are part of SNS, right? And this is the tool that you see on the right side of the screen. And it gives you step by step what you need to do, and in case you're experiencing any difficulties or you're unsure of some of the implementation questions or questions that might come up, what you need to do at those particular moments, there are references in terms of where you can find those answers on the sheet itself, right? So we have the planning stage, which is graded in yellow. We have the SNS training itself, because you have to be trained in SNS in order to provide the specific service or in order to implement SNS or social network strategies. So the training is the first thing, first and foremost, right? So the caller identify, the information that you should have gotten from the training, the resources that you should have gotten from the training. And we have the green, which is really the implementation steps, right? What those steps might look like and what those steps should accomplish or should entail. So let's look at this, what this entails much more further, right? So how the use of the tool to evaluate SNS implementation steps, right? How do we really utilize this tool to enhance, our services or the implementation of SNS, right? Planning phase, attend the training. And second, you want to identify priority population, right? So who is the person that you're trying to identify for your CTR services that you know are at risk in your particular area? However, for some reason, you are unable to get to them, right? So who is that priority population that you really want to focus on and you really want to provide testing services to? Do population segmentation, right? So population segmentation is going to help you further narrow down. Yes.
We're not seeing your slides. We're still seeing the housekeeping slide.
Oh, really?
Yes.
Oh.
I don't know if that's true for everybody, but that's what's going on here. When it went back to the housekeeping slide, it never moved from that.
Okay. Thank you for letting me know.
Okay.
Let me get back to, okay. Is it on now? Can everybody see the screen now? I'm not getting any response. I'm not sure if you are able to still see the screen.
Can you hear me now?
Yes.
Yes, it did go back to your slideshow.
Okay. Okay, perfect. Thank you.
Yep.
All right, so here we are on the planning phase, right, before implementing SNS. Again, like I mentioned before, you want to attend SNS training and identify priority population, who you want to focus on, who you know is at risk based on the data that you have, however, are not coming in for testing, and do population segmentation to really narrow down how to, reach out to this specific population through the recruiter that you're going to be recruiting for reference, for referral within the social network, right? And identify high risk. Because high risk, what do we mean by high risk? Well, what does high risk mean for you or to you at your specific agency? Is it an individual who is having condomless sex, however, not on PrEP, right? Is that person high risk? Or is an individual on PrEP but is having condomless sex and you're still worrying about other sexual transmitted disease? So you need to really narrow down what high risk means to your program or your testing program to identify and coach the recruiter to really be able to know how to gauge what high risk is when they're discussing this with their network associates. And recruitment plan for SNS recruiter can start it in-house, case management, for example. You can design a flyer specifically for SNS program and for your testing program because you are specifically looking for a specific priority population that you want to capture. Right, so we're still on the planning phase, right? So once you identify that high-risk population, what is your plan to recruit recruiters who's going to then bring you their network associate or their social network members, right? what is that plan? Are you going to reach out individually by phone to other agency and tell them, oh, this is the type of recruiter that I'm looking for? Are you going to design a flyer? Are you going to put out a little script somewhere, put it on a social media? However that you want to attract a potential good recruiter, you want to develop that plan so that, you know, you can access that recruiter who then have access to other high-risk member within their social network. So you want to start enlisting recruiter. Is there any questions, or what questions do you have at this particular point of the information? And I'll go back to the screen to make sure that I'm able to see the question on the chat box. As you can see, I'm not. So let me see. How do I get back to? Is there any questions? You can unmute your phone and then ask. I'm not able to see the chat box right now, but please just unmute your phone and ask questions if you have any question at this particular moment. Okay. If there isn't any question, then I'll continue. Is anyone able to see the screen? Because I kind of go back to the Ready Talk meeting control. However, I'm not able to see the box, but I want you all to be able to see the screen, to see the information.
Yes.
Okay, perfect. Thank you. All right, so we're going to continue with recruitment of seeds, right? Recruitment of seed is recruiting that good, perfect fit recruiters who fit a target population or a priority population and who has access to other members within that particular social network that he or she have, so that they can bring in new high-risk individuals to get tested as well, right? So recruiter criteria. So who is that recruiter criteria? Well, what characteristics should you be looking for when it comes to those recruiters that you're looking for, right? We recommend that the recruiter or the first index recruiter be HIV positive. Why? Because if there's HIV positive within that specific network, then there are risks. It presents a risk within the social network if they're engaging in high-risk behaviors. Recruiter could also be a high-risk negative themselves, who perhaps is not on PrEP or on PrEP, depending on how you are defining what high-risk is, right? You want the recruiter to fit the priority population, right, for SNS to be identified. Because if you identify a recruiter who doesn't fit or have access to the priority population that you're looking for, you may get other population that you are not necessarily focusing on at that particular point of time, or you're not ready to provide services to regarding or however you have identified SNS to bring or to yield specific outcome that you're looking for when it comes to a specific population. So if you want to test more MSM of color, then you want to make sure that your recruiter have access to MSM of color, or that recruiter fit in that specific priority population themselves. All right. So now we are in the training phase, which is you need all the participant or anyone who will be coaching recruiters for SNS to be training SNS, right? So they have to go through the training, which they will receive a manual which will provide information such as the worksheet, planning information that they will need to refer to once they start implementing SNS. Are there any questions at this moment, or what questions do you have about the planning phase or the training itself, and what materials you need for SNS implementation? Okay. If there are no questions at this particular moment, I'll just move on to the implementation phase, right? So the implementation phase entails orientation, recruiting network associate, coaching sessions, HIV testing, and evaluation of the program. So orientation, what does the orientation look like? So the program expectation. We want during the orientation, at this point of the program, you have your recruiter. You went through who is a good fit for a recruiter, and you have found a few recruiter, 1 or 2 or 3, depending how you identify how you want to run the SNS program. You have your recruiter now. Now you explain to them what they are to expect participating in this specific program, right? What is the program expectation of the recruiters? Are the recruiter willing to bring in their network associate? Are they willing to bring member from their social network? Will they be able to attend coaching session, right? Because they're going to be ongoing coaching session throughout the time that they'll be talking to their network associate. They'll be talking to their friends, people that they know that have this high-risk behavior that should benefit from HIV testing. And you want to get their consent. Make sure that they're consenting to doing this work, although they may not be an employee of the program. They're just volunteering and bringing their network associated to you so that they can have access to testing. And once they're consented to do or to participate in SNS, then they can start recruiting, right? They can start recruiting their network associate to come in for testing. And this is where coaching session begins, right? So you want to coach them in terms of what to look for when it comes to the risk, the high risk that you identify, understanding, screening and how, to be able to discuss HIV, risk behavior, so that they be able to come in for testing. Just be aware that your recruiter are not doing HIV education. It's not important for them to know everything about what HIV is. They just need to be able to make that introductory step so that the network associate will be willing to come in and talk to provider themselves so that they can get the right information. So the recruiter does not need to be educated or trained to have a formal knowledge of HIV 101. It's not necessarily. You will do a coaching session for each network associate that the recruiter will bring in. So you will discuss specifics in terms of what the risk behavior entails and how they can come in for testing. Will the testing agency go to them? Will they come into the agency? Will they meet somewhere else to get the testing done? But just to provide all that information so that the network associate know where to go for testing. And then the last piece of once the recruiter, the network associate has that information, they come in and they complete HIV testing as usual. And you do the testing just like you would do HIV testing to anybody that comes in for testing. You also do a screening and whatever your program entails when it comes to HIV testing. And when it comes to the tool, this is when the implementation comes in, right? So then you have the network associate comes in, they come in for the test. So there goes to step, have the recruiter receive orientation, right? Because orientation has already been done. Once orientation is done, network associate comes in. Here's a little point for you here on the tool, have recruiter identify high risk NA. So once the NA comes in, right, does this network associate risk behavior identified as the high risk behavior that you have already established? Is the NA recruiter for a social network, right? You want to make sure that you can identify where this specific person comes from. Is it from your recruiter's network? Because you don't want to confuse anybody that walk in with the SNS program. You want to make sure that the person that come in for testing can identify that, yes, my recruiter John refer me to you for testing. And then you conduct the testing, right, at the end of once they come in. Oops, I think I just went behind. Are there any particular question at this point of the tool or of the implementation phase?
Hi, can you hear me?
Yes.
The tool, and just to go back, is for an administrator or program coordinator. Is that the focus of the tool itself? Will we receive the tool? And then also, is the tool adaptable?
So yes, you will receive the tool. I'll send out at the end of the webinar, I'll send out the evaluation along with the tool and the recorded webinar. Program director or program manager can utilize the tool, as well as staff members can utilize the tool. But the tool, in terms of adapting the tool, it's designed to give you a step-by-step guide so that you know where each point comes in and you know if there's a missed opportunity. So you can utilize the tool and see if you can incorporate it into your specific program. Yeah, that's fine. However, I'm not sure what you mean by adapted.
Is it fixed? For instance, if I wanted to translate this into another language, is that possible?
Of course, yes. Yes, you can do that.
And then also, will we be receiving part of the SNS strategy, all the worksheets that are accompanying the strategy as well?
So all the worksheets should have been received when you did the training.
Okay.
Did the training, the worksheet comes with the materials that you received then.
Okay.
Are there any questions? Or one more question do you have? So here you see that, as you look at the tool, whenever any answer is no and you need additional information, it makes reference to the tool at each specific point of the tool. So you can go back to your worksheet that you received during the training, and you will get much more information regarding where you are having difficulty at that specific step that you have. So here is the tool all together. This is what you'll be receiving when I send the information out. When I send the email out, this tool will be attached to it so that all of you will have access to the tool and utilize the tool. So this is what it looks like from the planning phase all the way to the implementation phase. What questions do you have? Okay. So this is the end. It's not the end of the webinar, but this is the end of the tool. I'm going to attempt to go back to my Ready Talk screen. I don't know what I did. My expertise with technology is not all that great. However, if anyone have any questions or unsure how to utilize the tool, you can always contact me. This is my contact information. please don't hesitate to contact me if you have any questions or you're still uneasy or confused in terms of how to implement the tool along with the program. I am an SNS trainer myself, so I'll be able to answer your question or guide you through the tool if you have any questions. Are there any more questions? Is there any questions that you're still unsure of, something that didn't make sense as I was talking, or during that time where the screen was lost and you weren't able to see my screen? Please, if there are questions, please, now is the time to ask those questions. All right, I'm not hearing any questions, so I'm assuming that everybody is okay with the tool, understanding, and be able to, implement it, and really give that boost to the SNS program that they're implementing. Next, we have another webinar, another quick, tips and tools that we will be doing on the 20th of April. So April 20th, the webinar will be on charting the process tool that we also developed here at the Hands United at the Latino Commission on AIDS. And stay tuned for that. We will be sending out emails for registration when the time approaches. And then you can also participate in that charting process as well. Thank you all for sharing, for participating in the webinar, for coming, and thank you for letting me know about missing the slide or, being disconnected from the slide earlier. Thank you so much for participating. Be on the lookout for the evaluation and the tool itself that I'll be sending through in the email. Thank you so much, everyone. I'm still available in case everyone has a question, but if not, have a great afternoon or morning wherever you are, if you're on the East Coast or West Coast. Thank you, everyone, for attending the webinar.